Hi, I'm Dr. T, and I'm a pediatrician. On Ask Dr. T, I answer health questions from teens. Questions ranging from safe sex to self-love to questions about body parts. Let's get this episode started. This set of questions is all about sex and intimacy. Question number 1. Can two virgins having oral or vaginal sex without protection transmit STIs? It's a very good question. So there are a few different points I think that are worth discussing here. First of all, the definition of virgins. So different people have different definitions of what virginity means. And so before you go assuming things about a partner, talk specifics. Don't ask, are you a virgin? Say, have you had penis to anus, penis to vagina, oral sex? And that's going to be a better indicator of someone's sexual history. The second thing is, oral sex can still transmit STIs. So if someone says, I'm a virgin, and a lot of people consider penetrative sex, so penis to anus or penis to vagina, to be virginity, someone who has had oral sex can still catch or transmit sexually transmitted infections. These include gonorrhea and chlamydia, herpes, HPV, HIV, so all of them you can catch with oral sex. So knowing the specifics of what type of sex your partner has had before will also give you an indication of if you two are at high risk for transmitting or catching an STI. And then the last thing is knowing what types of STIs are regularly checked. So if your partner has been sexually active before or had oral sex, keep in mind that the types of STIs that we check for during STI checks are going to be gonorrhea and chlamydia and trichomonas, and then the first time we usually look for HIV or syphilis with blood. But other than that, we don't look for specifically herpes or HPV. And those are going to be kind of silently transmitted for a lot of individuals. And so just keep in mind that if someone says, I'm clean, I've been checked, it still doesn't usually cover herpes or HPV. So know your partner, know the specifics about their history, and then if neither of you have had any history with anybody else, the chance of transmission is going to be 0. Question number 2. I recently had sex and immediately started bleeding. It's been 16 days and the bleeding hasn't stopped. Sex has always hurt, but is this normal? Okay, so this is kind of a complex question. First of all, bleeding after sex, and usually after the first time or the first few times, the bleeding is going to be generally from the hymen tearing. That should resolve if it's left uninterrupted. So if it's allowed to heal on its own, it should heal within 24 to 48 hours or so. You should have no more bleeding. And when we say bleeding, I'm talking about, a little bit of blood that you might need a pad for, or even some spotting on your underwear. But it should resolve within the first day or two after intercourse. And then repeated trauma or repeated intercourse can tear that tissue if it's not totally healed. So that would be one thing to consider if you haven't let it totally heal. But if it has been 16 days of uninterrupted bleeding or spotting, that would be abnormal, and I would probably see your doctor about it. It's tough for me to say exactly what's going on. Could be nothing to worry about. Could be that you have a bleeding problem or a clotting problem where you don't clot things off as quickly as other people. But the other thing to consider is that you said sex always hurts, which suggests to me that this was not your first time having sex. And Things that can also cause bleeding after intercourse, after you've already had intercourse, could be hymen tearing, but realistically it's probably going to be more things like an infection or some sort of irritation of your vaginal canal, which can also happen if you're using condoms and you're allergic to latex, or even semen allergy can happen. So there are a few different things that it could be, but regardless, I would say if you're bleeding for 16 days, it's worth seeing your doctor. Question number 3. Is it safe to have sex after getting the COVID vaccine? I know that there are some recommendations about do's and don'ts, such as drinking, sports activities, and so on, but I'm not sure about this kind of activity. Totally safe. No contraindications. Question number 4. I recently got a Pfizer vaccine, and I'm on birth control. Is there a drug interaction between the two, and is it going to affect my period? So the first part of your question, is there a drug interaction between the two? No. You can have the vaccine and your birth control will still be as effective as it was before the vaccine. Just keep taking the birth control around the same time every day as prescribed. Regarding the period changes, so there has been some media, there have been some reports about people experiencing period changes after getting the vaccine. That hasn't really been supported by the research, but that being said, I'm sure some people have experienced this. And the likely mechanism is that when our bodies experience stress or some sort of increase in cortisol levels, so that can be infection or inflammation, and probably some inflammation following the COVID vaccine, that increases your cortisol levels, which can interfere with your natural hormone levels that regulate your periods. However, if you are on birth control, so you're already taking hormones and you're kind of overriding your own hormones anyway, then the chance of any interaction I think would be minimal for you. So I wouldn't expect changes to your period. All right, question number 5. Is it normal to have bruising in the mouth after giving a blowjob, like a cluster of red dots and a yellow area that looks like it could be bruise colored? Okay, so it could be normal for you. That would be in particular with sort of aggressive blowjobs, but the more likely mechanism is going to be from sucking. So when you suck very hard on something, you can get petechiae, or little blood vessels or tiny little capillaries that burst on the surface of the skin. So that can happen on other parts of your body, including in the mouth. And so I suspect it's probably more from sucking that you're noticing some of the spots in the roof of your mouth rather than aggressive hitting against the roof of your mouth, but it's possible. And they should go away within a couple of days. Bonus question number 6. I fingered myself and now I'm bleeding. What should I do? You should relax. So there are a couple of things that you may have done. The first thing is you may have torn your hymen a little bit, and that's okay. Like the previous question, this should really resolve within the first 24 to 48 hours. If it doesn't, you should talk to your doctor. The other thing that it could be is that you may have cut your vaginal canal with a nail or something, and that will also take a little bit of time to heal. Again, spotting after 24 to 48 hours would be abnormal, so it should heal within that amount of time, unless you have repeated trauma to the area. So try not to insert things while things are healing, if that makes sense. All right, that's been a round of sex questions. And remember, if you have a question for Ask Dr. T, you can either respond in this video or submit through my website, askdrt.net.